Why are we here? What is this rally about? I mean, we got to ask that question, okay? Are we here to complain and whine? No. We recognize right now the current system we have is not ideal. We are not here to rally for the status quo. Do we all agree about that? Yes. Okay. So we agree. I think we all agree there are problems, we need to address them. That's clear. Now, what about some of the issues that have been raised by the President, by the Congress? Do we have problems with those? Well, let's go down the list. Let's talk about this a little bit. Do we really have any problems with health insurance reform? For example, are we frustrated with some insurance companies in their lack of providing care for some of our patients? So how do I feel when a patient comes to the office and I say, you need this particular brace? Dr. Sallay, I'm sorry, the insurance company says I can't have that. How do you think that makes me feel? Is that a good thing? No, it's bad care. So that needs to change, okay? Well, what about eliminating the issue of people being denied when they get sick? Do we agree on that? Is that fair if a patient has some illness and they get denied coverage? No. I think all of us as physicians, empathetic people, understand that's not right. Do we all agree that we need better efficiencies in our healthcare system? That we need to emphasize high quality and control cost? No, we've already been working on high quality care. It's not like this is a new idea. We've been doing that, and we want to continue doing that. We want to continue to raise the bar and provide the best service possible. Now, what about integrated healthcare delivery? Do we have a problem with that? Leveraging information technology, are we opposed to that? No. So it seems like so far we're in lockstep with what the President and what the Congress is saying. Here's the big difference, and Dr. Frazier talked about this. It's the philosophy. How do you accomplish these changes? That is a very, very important detail. So right now what you're hearing is we want to have government control your destiny. If you read these bills, and I urge you to read these bills, it's painful, but if you read the bills, you'll find that there is sweeping legislation that basically gives control over our healthcare decisions, not to doctors, not to patients, but healthcare policy experts, faceless bureaucrats and bloated bureaucracies. Is that what we want? Heck no, we don't want that. That's awful. It's terrible. It doesn't work. We don't want somebody else making our decisions for us. You already heard that from our other speakers. I completely agree. I think we're all in agreement for that. We don't want a post office for our medical care system. And I'm going to tell you something right now. Oprah Winfrey, are you listening? If you don't like our health care here, go to France. Yeah. Out the door, okay? Because here's the deal. I have been traveling back to Europe since 1966. My parents escaped communism in 1956 to come to this country to start a new life, to get away from exactly what we're heading towards. My 85-year-old mother right now is beside herself because she says, you know what, son? This is how it started back in 1948, 1950, and it just got worse. Don't think it's not coming here if you don't make a difference. She's right. And I've seen healthcare in Germany. I've seen healthcare in Austria, where I have family and friends. I've seen healthcare in Hungary. It doesn't work well. You know what happens? It's a cultural thing. Europeans, are they happy? Yeah, they're not really happy, but they're used to it. They're already used to a substandard system. They've had it for years. They don't know any different. Why do you think people that have means in Europe and in the Middle East come here for medical care? Do you think it's because the European system's so great? No. They know where the best health care is. It's right here in the United States of America, period. There was a Gallup poll done, I don't know if you all saw it or not, but this was back in July, and they asked patients, who do you trust most to make decisions on your behalf regarding health care reform? Look this up. Fact check this. 73% of respondents said, I trust my doctor to make that decision for me. 38% said, I trust Congress and the legislature to do that. Now, are there good, hardworking people in the Congress? Absolutely. Are they experts in healthcare? No. Why aren't they asking us for advice? Oh, whoa, wait a second, Pete. We've already asked the AMA. The AMA has sanctioned this, and they think it's okay. Whoa. The AMA doesn't represent me, doesn't represent the majority of you. They represent 17% of practicing physicians, and they are a dying entity. They don't represent us. So don't even go there. Hey, Barack, this is not emergency surgery, okay? Let's get that very straight. If the president and the current legislature, the legislators who support these bills were in medical school right now, I'd flunk them. Because if I took care of a patient the way they're taking care of health care, the patient would die. We don't just rush in on the chronically ill patient and say, well, I don't really know what's going on here, but heck, why don't we just do an exploratory laparotomy? That sounds like a good idea. No, you're going to flunk if you do that. So please, 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 Evan Bay, are you listening? Yeah. Don't do this. Slow it down. Think about what you're doing. If you screw this up, not only are you not going to get reelected, we're all going to be the victims, and our children will be the victims for years to come, because you will never undo this. I promise you. If you pass this bill, we are in for it. You'll never undo it. All right, quick solutions, you've already heard them. You got to break up the monopolies, guys. You can't have exemption from antitrust if you're an insurance company. I'm sorry. I want you to be a good, healthy business, but let's face it, you guys are fat cats. You've been feeding off the patients and the doctors and the providers. That's very clear, okay? That needs to stop. Doesn't mean we want to put you out of business. We want good competition. We want the Geico and the Progressive and all that, so that patients can choose what fits them best and pay for it the way they want to pay for it. You got to give, you have to fix Medicare and Medicaid first. Don't expand it. It doesn't work. You've been a proven failure. Why would you expand that? Fix it first. Prove it to us that you can do that. We'll talk later. And doctors, I'm gonna harp on you a little bit. We gotta step up, okay? We gotta step up. We have to accept the fact that we need to be engaged in healthcare debate. We need to move forward with our own incentives to provide better care. We need to drop cost. You know, we need to do a better job of analyzing cost. So we can do that. We just need to be engaged and we need to be involved. And this shouldn't be something that comes from a healthcare policy expert. I don't want somebody telling me what joint prosthesis to use, but you know what? I'm going to listen to a group of my peers. And so if the American Academy of Orthopedic Surgeons decides that, hey guys, we need to do this and here's how we're going to do it, I'll listen to a group of my peers who are experts in the field that I practice in, not some Joe Blow in Washington, D.C. We need to give patients incentives to take care of themselves. Our obesity epidemic is ridiculous. A third of our population is obese. That's just unconscionable. And if you solve that, you solve a lot of the dollar problems that we're talking about right now. Why is Europe so better? Why do they live longer? You know what their obesity rate is in France? It's 9%. It's 20% less than here. That's the differential right there. If you solve that, you've gone a long way to solving a lot of problems. All right, so I'm going to end real quickly. I just got one question for you guys. Do you trust the government to make your health care decisions for you as a doctor or a patient? Hell no.
Hell no. That's right.
I'm going to quote from Ronald Reagan, since we're on a roll here with Ronald Reagan. The 11 most feared words in the English language are, I am with the government and I'm here to help. Contact your senators. I want you to go out and bug Evan Bay. Richard Lugar, I hope you're listening. Don't waver. Thank you very much. God bless you.